Now, this may come as a bit of a surprise, but it turns out nursing has one of the highest rates of workplace violence in the country. Local News 8's Chris Nessman live in front of Eastern Idaho Regional Medical Center. So, Chris, you told us at 5 that according to a survey, 1 in every 4 nurses is physically attacked by a patient.
Yeah, that's right, Carol, and it may come as a surprise, but 1 in 4. Now, it's most common in places like emergency rooms or psychiatric wards, but it's one reason why hospitals like Irmac give extra training to their nurses to make sure that they're prepared for when they have to deal with those kind of situations. While it's an extreme case, this footage from a Minnesota emergency room showing an out-of-control patient is just one example of some of the problems that nurses have to deal with.
Sometimes patients do come in and they are violent, related to a multitude of reasons. People have organic brain problems, inorganic problems.
It's one reason why more and more hospitals like Irmac are giving their nurses resources to protect themselves and patients.
We give them a 12-hour course on essentially how to de-escalate a situation. So if they're faced in that situation, they have some resources to pull from on how to make an unstable situation a calm situation.
For most instances, talking and calming a patient down does the trick. If it doesn't, Irmac has the IFPD. Off-duty officers can work part-time as security officers for the hospital on the side. These officers can be that second line of defense to protect people.
It's daily that we are getting called in, but it's not bad. We're not having to use any kind of force other than potentially just trying to talk to them and talk them down so that they can get their questions answered from the medical professional.
Hospital staff say having officers on hand has made a huge difference for their work environment.
Just the presence of having law enforcement in the hospital is typically enough to diffuse any kind of a situation. It's been a big help to our facility.
The officers like it too because they feel appreciated and make a bit of extra income on the side.
So our nurses are very nice here, so being nice back is probably the best thing that you can do.
The hospital and IFPD have had a working relationship since 2008, and often they have more than one officer stationed here just in case. Reporting live from Irmac in Idaho Falls, I'm Chris Nessman.
All right, thank you, Chris. Irmac isn't the only hospital in the area that provides training for their nurses. Most other hospitals in the region, including Mountain View and Mattis Memorial, provide this de-escalation training to help keep their staff safe.